In this video, we are going to be looking at what the normal flora is and pathogenic microbes, right? You'll be hearing normal flora, pathogenic microbes. What are they? I'm going to be using a table. Normal flora, then pathogenic microbes. The normal flora are microorganisms that you can find on specific or different anatomical sites in our body, living there without causing diseases. These microbes are usually beneficial. They usually have a beneficial relationship with the host. They produce metabolites. They produce things that actually benefit the host. While pathogenic microorganisms are organisms that cause disease, they are pathogenic. Pathogenic simply means disease-causing organisms. Now, what are those anatomical sites that you have in your body where you can find the normal flora? Example of such sites, we have the skin. The skin is an anatomical site, and on the skin you can find Staphylococcus species. Yes, the next place we can find that we have the normal flora is the gut or the large intestine. And here some of the species that you can find is the bacteroid and Escherichia coli. These are some of the organisms that live in this area. When I'm saying anatomical site, I simply mean organisms that you can naturally find in this area. If you culture your skin, you can find Staphylococcus species. Another place that we have the normal flora is in our mouth. Our mouth has its normal flora. There are organisms that are naturally existing in our mouth. For example, you can find some Streptococcus species existing in our mouth. Then another place you can find the normal flora is in the vagina. Yes, the vagina. It's an anatomical site that has its own normal flora, and one of those microorganisms that you can find in the vagina is the lactobacillus species. In fact, it's the most dominant of the organisms you can find in the vagina, and it plays a very vital role because it helps to maintain the pH of the vagina. That is why some of those things that people take, so let them balance the vaginal pH. You don't need it. As long as you have lactobacillus active in the vagina, you don't need to take drugs or take those things to balance pH, because the lactobacillus also already does that. Another organism you can also find in the vagina is Candida. Yes, Candida. You can also find Candida in the vagina. What are pathogenic microbes? We've said that they are microbes that cause disease. Example of such microbes are Vibrio cholera. This is a pathogenic microorganism. It causes diseases. It's a causative agent for cholera. And another organism that causes diseases is the Neisseria gonorrhea. These are pathogenic organisms. They cause disease. We have many more examples of pathogenic organisms. Now, just because we said an organism is a normal flora doesn't mean it cannot cause disease. In fact, that is why we cannot necessarily divide microorganisms into good or bad, because the relationship of microorganisms with the host depends on different factors. Number one is the location. This E. coli now that we find in the gut, if it finds its way to extra-intestinal sites, like in your urinary tract, it can lead to urinary tract infection. So it goes from being a normal flora to being a pathogenic microbe, an opportunistic microbe. We call them opportunistic microbes. Even Staphylococcus species, if you have a break or a damage of your skin and it finds its way from the surface of your skin into your tissues, it can cause disease. It can cause toxic shock syndrome, right? It can lead to very fatal consequences or outcome. Just because it's normal flora doesn't mean it will never cause disease. We have talked about location. If it moves from its natural location to another location, it can cause disease. Now, the next factor we have is the balance. There's a reason why we have the normal flora, because one of the functions of the normal flora is to compete with pathogenic microbes for attachment sites and nutrients. But when there is an off balance of that normal flora, for example, let me use the vagina. Candida is a part of the normal flora of the vagina, but when there is an off balance, probably the abuse of antibiotics or regular use of antibiotics or using of douche or things that can throw off the pH of the vagina, it can lead to the overgrowth of candida, and in that case it now causes a disease called candidiasis. At that point, candida is no longer just a normal microbiota, it has become an opportunistic pathogen. So the relationship of microbes with hosts depends on location, microbial balance, and then your immune system. If you have weakened immune system or underdeveloped immune system, organisms that normally would not cause disease can take opportunity of that and cause disease. So we are not just asking, oh, is the microbe bad or is good? We are asking, is it a part of the normal flora and can it cause diseases? But for pathogenic microbes, they are pathogenic. They are, from their onset, they are pathogenic. Like Vibrio cholera, you get it from contaminated stool, feces, water. So they are pathogenic. When they find their way into the body, they are not like the normal flora. They cause disease immediately, whether site or no site. They don't do all those ones. They cause disease because their nature is to cause disease. I hope we have learned something here. The difference between the normal flora and the pathogenic microbes. And another term I also introduced are opportunistic microbes, meaning that the normal flora can become opportunistic pathogens if the conditions are right, but they can continue to remain beneficial if the conditions are also right. So that is the lesson for today. See you on our next topic.